Honourable Speaker, yesterday Manitoba heard this government's throne speech, and there are concerns. For example, you can't mandate nursing ratios and remove overtime without first hiring enough nurses. According to a CBC article from yesterday that I'm tabling now, Manitoba's Nurses Union and the Manitoba Association of Healthcare Professionals explain how hospital staff are still facing burnout and sky-high vacancies. MNU's president, Darlene Jackson, straight up said that we're still in a nursing shortage. Can the minister responsible please share how hospitals can be expected to meet the government's mandate when there are not enough nurses on staff?
The Honourable Minister of Health, Seniors and Long-Term Care.
I thank the member from Tyndall Park for that really important question. Our government has worked very, very hard alongside healthcare providers and experts in this province and across government, across different departments, to move staffing in the right direction. Manitoba nurses across this province have made it very, very clear to us that gone must be the days of using mandated overtime as a scheduling tool and tactic. It's unacceptable, Honourable Speaker. We have to do better. Bringing forward this legislation is going to hold regional health authorities and leadership accountable to approaching staffing the right way. And we have done a tremendous job alongside the front lines, alongside our partners in staffing healthcare. We have over 1,200 net new nurses working in this province. That's a big deal. That's a big step. And we know there's more work to do, but we're not taking our foot off the gas, Honourable Speaker. We're going to continue to hire thousands of net new nurses and make sure that they can work in a workplace that balances, work-life balances, and they can go home to their families when they're scheduled to.
The Honourable Member for Tyndall Park on a supplementary question.
Honourable Speaker, in yesterday's throne speech, I was glad to hear that access to health is being made a priority. However, a concern about health cards has been brought to my attention. The new plastic cards lack features found in other provinces, and the QR code feature is not being used in most healthcare facilities. Why would the government spend almost $6 million and hire 20 full-time workers for plastic cards to only months later provide a digital option? Over 200,000 people registered for a new plastic card since May. Does the government feel that they were fiscally responsible with this decision, or should they have provided Manitobans the option of plastic or digital from the get-go?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, our government believes in the opportunity for Manitobans to have the freedom to choose. We believe in supporting their ability to choose what works best for them, for their families, and it was important for us to get out of the dark ages of the PCs, where paper health cards with coffee stains and tears and tape on them were the way that people had to access care. We've done better. We've moved over to plastic health cards. You can use your plastic health card to book an appointment on our website, medinav.ca, and see a doctor or nurse practitioner in the same day. And now we're moving to digital health cards. That's an important step to modernize our healthcare system. We know there's more work to do, and we look forward to sharing more good news with Manitobans as we continue to do the work.
The Honourable Member for Tyndall Park on a final supplementary question.
Honourable Speaker, for decades, Manitobans have experienced long, often more than 24-hour wait times in ERs. Concerns have been raised about the unsafe experiences from the Manitoba Nurses Union, Winnipeg Regional Health, and directly from hospital staff and patients. There have been assaults and public disturbances in and by our healthcare facilities, and unfortunately, police intervention is becoming normalized to the point of not reporting. Manitobans are confused about the patient safety charter that this government failed to release details about or consult on. Can the minister clearly explain what the charter is and how it will provide protection?
The Honourable Minister of Health, Seniors and Long-Term Care.
What I would say to the member is that we look forward to bringing forward more details about the Patient Safety Charter, but I do want to speak to the work that our government is doing to ensure that frontline healthcare providers, that patients and that visitors, that they all feel and are safer and more secure when delivering and accessing healthcare. Everybody should be safe at work. Everybody should be safe when they're accessing healthcare or visiting a loved one in a healthcare setting. We've taken a number of steps to move that in the right direction. And so if you're maybe one of the students who are in the gallery here today and you're wondering about safety in healthcare, I want to reassure you that our government is working very, very hard with experts in this province, with the Winnipeg Police Service, with the Justice Department, and with our healthcare settings to make sure that you and your loved ones are safer and healthier.
Time is